The following program is brought to you by Naleo TV, the People's Platform. This program is freely available to the public, thanks to the generous funding from Hui Pohala and the Hawaii Department of Human Services, MedQuest Division.
In our previous episode, we explored what is palliative care and who can benefit from it. Our special guest, Dr. Linda Dolan, Hilo family physician and palliative care specialist, emphasized how palliative care helps the patient and caregiver better understand their illness, medications, and how to get support within the healthcare system. She also described how a palliative care team, also known as the Kupu Care team, that consists of a nurse practitioner, a registered nurse, and a social worker, to teach both the patient and caregiver at home on how to manage symptoms such as pain, nausea, anxiety, insomnia, and constipation to avoid costly trips to the emergency room. Dr. Dolan recommends palliative care because it allows the patient to live on their own terms based on their values, wishes, and life goals. Aloha and welcome. I'm Lonnie Weigert, your host for Let's Talk Healthcare Hawaii, a new healthcare series to help our community navigate through the many challenges of acquiring quality healthcare for those living with a serious illness such as cancer, congestive heart failure, COPD, kidney, lung, and liver disease. So ho'olohe, listen up, especially those caring for a seriously ill relative. You will not want to miss a single episode. If you've never heard the term palliative care, don't worry. You are not alone. The goal of palliative care is to prevent visits to the emergency room, boost the quality of life, and relieve suffering from chronic illness and treatments such as chemotherapy, radiation, dialysis, and surgery. Whether you're new to palliative care or not, this series is designed to raise your awareness on acquiring community resources, making timely and informed healthcare decisions with your physician and palliative care team that will benefit you and your ohana. Makaukau, are you ready? Let's get into this episode. In this episode, we will explore how do I sign up for palliative care and what will my first visit be like. Joining my discussion will be Kiana Foster, Clinical Operations Manager for Hawaii Care Choices, who also leads the admissions team. Kiana comes with a wealth of knowledge on the process of signing up patients to receive palliative care. She understands the power of creating a friendly and reliable connection early with patients and families who need support at home. We have lots to unfold. Let's get into it. Aloha, Kiana. Oh, I'm so glad that you are with me today. I have tons of questions that came in from the community. And the first question is, so if somebody is told by their doctor, or maybe they're thinking they could use palliative care, how would they access that care?
Yeah, aloha Lani, and I love that we're starting off with that question because I actually was just talking to somebody that half the battle is knowing resources, what's available out there, and how to connect, how to access it. You know, historically, and I think people in general, I experienced it in my ohana too, is that they definitely religiously follow the lead of the PCPN specialist. But with our palliative care program and services, people can actually initiate a referral themselves. We call that a self-referral. Yeah, so that means that the patient can call into us or their loved ones can inquire about services. And now I absolutely love that because that's a total game changer. When people have awareness that they can call in themselves or their loved ones can explore what services is available, then that means that they can connect with palliative care services earlier. An earlier connection means that they can reap the benefits of palliative care services earlier for the present and into the future.
Oh my gosh, that's so empowering.
Yeah.
I'm pretty sure the community has no idea and they're waiting for their doctors to tell them. Tell me more about this empowering step.
Yeah, so don't get me wrong, because we can still have PCPs, specialists initiate referrals. And even if people land in the ED for a visit or they have a length of stay at the hospital, the referral can come to us from that angle as well. But what we're leaning into, what we're emphasizing, what we're empowering people to do is really want people in our community to feel empowered to make that call to us, to explore services, and to make that connection with Hawaii Care Choices.
What is PCP again?
It's primary care provider or primary care physician.
Awesome. Okay, everybody should have one of those. And,
yes, definitely.
And ED, what is ED again?
It's the emergency room or emergency department visit. At the hospital.
We want to try to keep them out of there.
Yes, most definitely.
Sure.
And that's the goal of palliative care, right? So we understand that making referrals themselves or even connecting to resources, that can be totally overwhelming and daunting. But when they call us, we try to make it as easy as possible. So we actually have a centralized intake team. They help navigate people. They are trained to ask the appropriate questions, to explore where they might be with their goals of care. They may ask for their diagnosis insurance, but all of that is important because that will help us to navigate them and to just make it that much easier for them to connect to our services.
Yes, this is so exciting. Okay, I want you to tell me more. Now, I'm thinking that our listeners are out there. They're thinking, all right, I think I need to get these services for Dad. What would I do? Who would I call? What should I expect?
Yeah. Excellent question, Lonnie. I love that. So they would actually just have to call our direct line for Hawaii Care Choices. It's 808-969-1733. And again, for our listeners, it's 808-969-1733.
Awesome. We'll be sure to put that on the screen so everybody can see it. Okay, so they call during the week. What days do they call?
They can actually call at any time. So we definitely have a full house on Monday through Friday. 8 to 6:30, but we also have people available on the weekends or after hours to take a referral or to answer questions.
Okay, because I'm thinking of people that they're working most of the day, and a mom or dad is staying home. No one's looking after them at that time, and so they might want to call, but they may have to call later in the evening. Is that okay for them to call then?
Yeah, that's totally fine. There's also an option on our website where they can explore or put in an inquiry, and that inquiry comes directly to our centralized intake team. It usually asks for their name, their number, their email, what is the contact information. Then we reach back out to explore a little bit more and ask them some additional questions.
That makes it so convenient. Thank you. All right. So when the person calls, what should they expect? Like, what kind of information should they have ready?
Yeah, excellent. So we definitely will need to get demographics, who their PCP, again, their primary care provider, their specialists. What is the challenging, life-limiting, or serious illness condition that they're experiencing?
Like, for example?
So, for example, if they're challenged with cancer and they're seeking treatment, we'll ask more questions, specifically what type of cancer they may be experiencing, who their oncologist is, how often they might be going to treatment. And gathering all of that information is important because once they make that connection and once they become eligible for palliative care, we then work with the PCP and collaborate with the specialists to gather their medical history, their medical records. Now, why that's important is because it helps our palliative care team to get to know the individual on paper as they prepare to deepen their rapport at the initial visit or consult that our nurse practitioner has with them.
I had a friend that sadly she was diagnosed with cancer. And once she received that diagnosis, she was just so filled with fear. For people that are hesitant to call in to get this help, what would you say to them?
Take the leap of faith. And often that's what it takes, right? Is they just got to chance them.
Yeah.
Because often people who have experienced our services one of the common things is I should have called earlier. Or why was I not told about these services earlier on when I first got my diagnosis? Because our palliative care team really rallies around them, right? From symptom management to accompanying them on PCP or specialist visits when appropriate, to making sure that they're provided with emotional support for them as well as for their ohana as they cope and navigate through it.
Kiana, thank you so much for coming in and sharing all of this manao with us, because it was so important for our viewers to know that they can just call us direct.
Yes, call us so
Empowered.
easy. Yes.
Aloha. Mahalo again.
Mahalo, Lani.
Mahalo, Kiana, for such a friendly exchange of information and reminding us when we're ready, it's all about the connections. Also joining me today will be Cheryl Paval, nurse practitioner and palliative care specialist, also with Hawaii Care Choices. She will share how easy a first visit to a patient's home can be. Besides evaluating the patient's health, she is a great teacher helping the patient and caregiver learn what to expect along their healthcare journey. Aloha, Cheryl. Thank you so much for being here today. I have a boatload of questions for you from the community, and I can't wait to get into it. So the first one is a person called in to ask if they sign up for palliative care, what can they expect on their first visit from someone like yourself coming to their home?
Well, that's a really good question, because a lot of people don't even know what palliative care is.
Yes,
right?
yes.
And so they're saying, why am I getting this referral? And why are you going to come to my house? Because normally healthcare isn't delivered at their home. So we make an appointment and you see a nurse practitioner, usually on the first visit, and I explain the program, the Kupu Care program.
So Kupu Care is palliative care.
Correct. As it is,
Okay.
yeah.
And it sounds like it's a fairly new program. Palliative care. Has it been around a lot? I think a lot of people in our community have never heard of it.
Well, actually, it's been around a lot for a long time. It's been around actually in the medical field for a long time. It's just now coming to the fore, though, because medical healthcare delivery gets changed a lot, and they've found that palliative care actually helps a lot earlier if they're referred earlier. And so in our own community, we've had Kupu Care program for a while, but it's gone through several different iterations and changes as the healthcare, landscape has changed too.
That's great. So when you come over to their home, which is so convenient, oh my goodness, I'm so impressed by that. When you come there, what kinds of things should they expect? Like, are you going to be asking them certain things? What kinds of tasks will you be doing on the first visit?
Well, like I said, the first visit is a kind of a getting to know you and trying to explain what the program is about. And so palliative care, when you try to explain it to somebody, sometimes it's like, I don't know, what are you trying to tell me? What are you trying to do for me? But so that's the first visit. And usually the first question is, what's going on? What do you understand about your illness, or what's going through, what are you going through right now? So those are the types of questions that, first of all, trying to figure out where the patient or where the client is.
So, explaining to them about their disease, do most of them know, or are you like the first one that actually explains it to them?
Well, you would be surprised, I think. There's a lot of times, I don't know if it's cultural. I don't know if it's the way our healthcare system is. You get so much allotted time with the doctor, and a lot of information comes at you. And sometimes, you get shocked with some of the things that they say, and you're trying to process all of that. So when they finally get a chance to process all that at home, they're like, I don't really understand what's going on. And so we I look at it as we translate a lot of, what the doctors and the providers and the specialists tell them. And so you would be shocked. I was just going to say, I think a lot of the times they don't.
Give me a scenario of somebody that you've come over to their home. Maybe they have cancer or CHF, or maybe both. And what are you able to do for them that makes a difference to the patient and the caregiver?
Well, so if they have, and that happens a lot. A lot of our patients
Oh,
have a lot of comorbidities, or what we call comorbidities, or several illnesses or things going on at the same time. And so what we try to do is just figure out what they need. First of all, if they know what's going on, do they know how to manage their, symptoms? What kinds of symptoms are they having? If they're having pain, which is our specialty, palliative care is for pain and comfort, we try to, see how it's impacting their quality of life and how we can intervene then.
wow.
Mm-hmm.
Quality of life. Okay, so when people don't have palliative care, are you saying they're just living with all of this chronic pain and discomfort?
Yeah, they might be. They might be.
Oh,
And so you know how difficult it is sometimes to get into the doctor's office. Transportation might be hard for them, or maybe they're in so much pain that physically they can't get out of their house. And so, trying to do that and trying to manage your symptoms or your pain or your discomfort can be really challenging.
so you know, it's really confusing for a lot of caregivers, at home because they want to get the care to their loved one, but they don't really know where to start. Like, does somebody come in and help them? Is there a whole team that comes and exactly who is prescribing the medication for their loved one? Because it's very confusing when when let's say the patient goes to the emergency room and gets medication there, and
A
then
whole
goes
other set of
then goes
Well,
to their primary
healthcare.
care provider, and then so does this team do medication as well, and how is that managed?
Yeah, I know. That's a really good question because let's just say healthcare in a nutshell is confusing, right? You're going to have several different doctors, maybe specialists. You go to the ER, just like you were saying, you get prescribed a whole set of another list of medications, and you may not know what they're for, how to take them, what kind of side effects they have. And so that's how we help. Is that we are an extra layer of support for the providers in the community and also for the patient themselves. When you're ill, you want consistency.
Yeah.
You kind
Yeah.
of don't have that sometimes here living
Yeah.
in our rural community.
Yes.
We have a lot of comings and goings, with the providers. And so we are a consistent source of information and support. And so we will help you with your medications. I'm an APRN, and so I collaborate with the doctors. I can prescribe medications or I make recommendations to the doctors for our clients or in our patients that may not be having the best symptom control. And so I work with them. And a really good example is that, Kupu Care is a team. And so you get an APRN.
And
You
Kupu Care is palliative care.
It's palliative care.
Oh,
Yeah,
okay.
yeah. So the Kupu Care program, the palliative care program, you get an APRN. You also get an RN who comes and monitors you, and then you also get a licensed clinical social worker.
Wow.
And so the licensed clinical social worker, I mean, it's a broad
Yeah.
area, but also they can help with any kind of referrals, financial or insurance, or any community resources that they may not have. So that's the first thing that we do is just like, where are you? And what do you need? And is there anything in our community that can help you? Or what do you need help with? Is it communicating with the doctors? Is it understanding your disease process? Is it managing your symptoms?
Wow. Cheryl, you have given us such a wealth of knowledge and the amount of support and connection it sounds like that our viewers could get by just simply calling us directly. Thank you so much for all of this information, and we look forward to our first visit.
You're welcome.
Thank you
very
again.
much.
Aloha.
Aloha.
It's an honor and privilege to introduce Evelyn, a palliative care patient who resides on the Hamakua Coast, offering her testimonial. Evelyn has been in our Kupu Care program, which is also known as palliative care, for almost 2 years. Let's listen up as she shares how her experience has been on Kupu Care so far.
Because you feel like you're not abandoned. You feel like you have some consideration of how you feel. You're way out here, you're by yourself, you're isolated, which is by yourself. But anyway, and it's just good to have somebody come on a regular basis to see how you're doing, and recognize you as somebody who needs help. I need help, even though I may not seem like I do, but I need help physically. So this is good. And as I said, you don't feel abandoned. You feel like there's a connection that connects you with the medical field, as well as just your community being. Yeah, because a lot of people don't know about this. They don't know about Cuckoo Care. I never knew about it until I was offered it. I had no idea what it was. And evidently it's not all that. It's fairly new. It's not something that has been around for years and years and years. They haven't required it yet. Now it's people are saying medical science is allowing people to stay alive longer. I've had several falls, and each time I had to go to emergency to make sure that I haven't broken anything. Usually I break something because I'm fragile at my age. That's it. I went through so much in the last 2 years. I don't want to go back to the hospital. I've had enough hospital. I've been in rehab. At Legacy, I was there twice. At Hawai in Honoka'a, I was there 4 times. I prefer to be home, most definitely. So this is good. And as I said, you don't feel abandoned. You feel like there's a connection that connects you with the medical field, as well as just your community being, So I can tell them about Cuckoo Care. I know what it is. And and a lot of times all my neighbors who come over, they want to know what it is. So they're happy that it's available. And I'm happy that it's available.
Mahalo nui, Evelyn, for sharing your heartfelt comments. We are so glad our team, along with your physician, can give you the support you need. Our Cuckoo Care team helps patients and families from Ka'u to Lapahoehoe. With all of the information that our wonderful guests have been sharing with us, it's important to take a moment to summarize some of the really important points that were shared with us today. So number 1, early connection to services can make a positive difference in a patient's quality of life now and in the future. What's important to remember here is the connection. The earlier you contact us, the sooner your quality of life will improve. Number 2, feel empowered to make the connection and call Hawaii Care Choices for yourself and loved one today. The point here is that you are empowered. You are in the driver's seat to take action on getting the quality health care and support you need now. Number 3, palliative care helps manage the symptoms of serious illness. Prior to palliative care, oftentimes people would just live with this chronic symptoms. Nobody has to go this journey alone. Getting the guidance early will help manage those uncomfortable symptoms. Number 4, hospice care is different. It is a specific type of palliative care that focuses on those with advanced illness who are receiving medically directed comfort care and no longer receiving treatments such as chemotherapy, radiation, or dialysis. Healthcare can be very confusing with so many different programs. It's important that you know the difference between the palliative care that we've been talking about and hospice end-of-life care. They are definitely different. Let me tell you more about our palliative care program. Who qualifies? Those with cancer, congestive heart failure, advanced renal kidney disease, advanced liver disease, chronic lung disease, also known as COPD. How are these services paid for? Palliative care, also known as Kupu Care, is covered under most insurance plans. You may be responsible for a copayment based on the type of insurance you have, similar to an amount you would pay when visiting a specialist. How does one know they need palliative care? Well, if you or a loved one is experiencing symptoms such as frequent pain, nausea, anxiety, shortness of breath, or depression, palliative care may be for you. Is your caregiver overwhelmed, tired, and frustrated? Are you visiting the emergency room several times in 60 days? Do you need to call your physician often? If you've answered yes to any of these, then it's time to consider palliative care. Getting the support early is key. Patients can receive palliative care at any age, ideally at the time of diagnosis. Early support can reduce anxiety and stress for both the patient and caregiver. Besides providing support, palliative care also provides solutions, such as education on managing your pain, discomfort, and nutrition. Also, a plan of care is created based on your priorities and values. Help with coordination for doctor visits and medications. Referrals to helpful services in the community, and also to ensure you have an advanced care directive. How is palliative care different from routine care? Palliative care is specialized care. While the physician focuses on the cure, our Kupu Care team focuses on the physical and emotional care of the patient and family, ensuring the patient's values, wishes, and life goals are at the center of their care. This holistic approach is why palliative care uniquely works. Plus, the care is provided in the comfort and convenience of a patient's home to help reduce stress, pain, and suffering associated with the illness, while also boosting the quality of life for both the patient and family. We hope this episode has raised your awareness about palliative care. For those living with a serious illness, it's such an honor and privilege to spend this time together. Mahalo for joining us. This segment will air every Thursday and Sunday at 7 p.m. on Naleo TV Channel 54 throughout this month, with a new episode airing next month. You can also view this on our Hawaii Care Choices YouTube channel. Mahalo to our ohana and friends listening over your favorite podcast channel. A new podcast episode will also be posted at the beginning of each month. For more information on this episode or to send us a question for the next show, please go to our website at www.hawaiicarechoices.org or call us Monday through Friday during normal business hours at 808-969-1733 to leave your question. I'm your host, Lani Weigert, sending you all much love and compassion until we meet again on Let's Talk Healthcare Hawaii. Aloha, ahui ho.
Mahalo to MedQuest. Hawaii Care Choices, Brenda S. Ho, CEO. And special guests Kiana Foster and Cheryl Paval.